Welcome back to Pharma Pro Mastery Hub, where pharmacy meets mastery. Today, on Know Your Medication, we'll be looking at the drug tranexamic acid. Tranexamic acid is an antifibrinolytic medication, and that means it helps reduce or prevent excessive bleeding by stopping blood clots from breaking down too quickly. It's available in oral form, that's as tablets and injectables. So let's look at the mechanism of action. Tranexamic acid works by inhibiting fibrinolysis. Now, fibrinolysis is a natural mechanism. It is a process by which the body breaks down blood clots. Now, tranexamic acid binds to plasminogen, preventing it from converting into plasmin, which is the enzyme that breaks down fibrin. And fibrin is a key component of blood clots. So what tranexamic acid does is that it stabilizes the clots and prevents fibrinolysis. It inhibits fibrinolysis. Now, tranexamic acid is commonly used to manage heavy menstrual bleeding, nose bleeds, dental procedures in patients with bleeding disorder, post-surgical bleedings, trauma-related bleeding, and sometimes in hereditary angioedema. And this is usually during off-label use. Now, side effects of tranexamic acid. Most people tolerate it well, but side effects may include nausea or vomiting, diarrhea, headache, muscle pain or back pain, and in rare cases we have visual changes, especially color vision. Then in very rare situation you can see blood clots, especially in high risk individuals. Contraindications. Do not use tranexamic acid in patients that have a history of blood clots or stroke, patients that have active intravascular clotting, subarachnoid hemorrhage, severe renal impairment, or known allergy to this drug. Remember, do not self-medicate. Always consult your pharmacist before you take any medication. Drug interaction. Be conscious when combining tranexamic acid with one oral contraceptive and two tretinoin. As a pharmacist, ensure you educate the patient about the dangers of combining tranexamic acid with oral contraceptive and tranexamic acid and tretinoin. As a patient, remember, do not self-medicate. Always ask your pharmacist in order to get clear guides as to how to take your medication to avoid drug interaction. Now, dosage and administration. Dosing varies based on indication, patient condition, and route of administration. For adults, if it is for bleeding control, is 25 to 50 milligram per kg per day, divided into 3 to 4 doses. For intravenous use, is usually 1 gram, which is 1000 milligram every 8 hours, tailored to bleeding severity. For heavy menstrual bleeding is 1000 milligram orally 3 times daily for up to 5 days. Important note to healthcare workers: ensure patients understand the duration of use, especially for menstrual bleeding. It's usually 3 to 5 days maximum. You monitor for signs of thrombosis, especially in patients on other procoagulant drugs, that's drugs that promote clotting. You clarify timing, and as you tell the patient about taking meals with the drug if there's any gastrointestinal upset. You educate the patient about visual side effects and refer if the report changes. If you found this information helpful, give this video a thumbs up and share with your pharmacy cycle. Subscribe for more clinical gems right here on Pharma Pro Mastery Hub, where pharmacy meets mastery. Thank you. See you in the next episode.